Hi guys, happy Monday. This is Sherry Miller Jolly with Dental Support Essentials, and I want to talk to you guys today about patient statements. One of the phrases that I tend to say over and over again with my dentist clients is that a patient statement is a patient portion that was not collected at the time of service. And it may sound funny coming from an accounts receivable company to encourage you not to send statements, but the truth is it is very difficult to get collections from a statement once the work has been completed. And so there are a few things that I would like to share with you that have positively affected the accounts receivable for many practices. And one of them is to having a strong eligibility protocol at your front desk. When you know the patient's policy, then you're more likely to know what the patient's really going to owe, and you're going to be able to more effectively collect at the time of service and eliminate the need to send a statement. The other thing that is paramount and actually should be number one on my list is knowing how to use your practice management software. It is a theme that I see over and over again for years. Almost every office, I teach them how to use something in their software or do something better in their software, or just ask a question of their company saying, how can I find this information? What I find from most people who work in a dental office is they were taught by the person sitting beside them, or they guessed and they clicked around till they figured it out. And that is really no way to use the software that actually runs your business. And you have to think about it like that. Your practice management software runs your business. It maintains your patient records. It maintains your accounting. It maintains your billing records. And if you were ever needing to know anything about your practice, you're going to go into your practice management software and get a report from there. And so those reports need to be accurate. But many, many times you have staff members who don't know how to create an accurate report because they're not utilizing your software correctly. The third thing is that you need to have a really strong policy on treatment plan presentation, and usually a strong treatment coordinator or insurance coordinator, whatever you call the position. But that person should be able to explain to the patient their needs. They should be able to explain to the patient their costs and schedule it in a manner that the patient can afford. And what I mean is, if a patient has a treatment plan that requires 5 visits, maybe they do 1 visit a month, something like that. But when you schedule services that a patient isn't sure how they're going to pay, or you don't have a strong financial policy, then what happens is the patients will agree to it. And if you aren't 100% telling the patient that you're going to need to pay this when you show up, you're going to end up doing treatment that you don't get paid for. And when you do treatment that you don't get paid for, it actually costs you more because you have to not only do the work and pay the staff that was there for the day of the treatment, but you have to additionally pay for staff to chase that money for months on down the road. And then if you do get paid, many times it is with a collection agency, which you're going to get significantly less, and you're going to end up in the hole or upside down on that particular service. So it's really important to have what I call the no surprises policy in place. And I also call it the mutual respect policy. You respect your patients enough not to surprise them with the bill. You're upfront with them about what everything is entailed with the services. You give them everything they need to make the choice. And then your patients will respect you by following your protocol and paying at the time of service. So if you implement those policies, what you will find is that the number of statements you send out every month will greatly decrease, and the number on the balance of those statements should greatly decrease as well. So I hope this helps you in your accounts receivables policies. Please check us out at dentalsupportessentials.com. Thank you.